So imagine you're on the scene of this big fire and you look over and you see one of your firefighters drop dead with a heart attack. That's part of the concern. Howdy, I'm Jason Moats. I'm the director of the USA Center for Rural Public Health Preparedness here at the Texas A&M School of Public Health. And I'm also a professor of practice in our Health Policy and Management program. So, my current research is all over the place dealing with, particularly with first responders and rural public health. When I came to the School of Public Health, it became an opportunity for me to research, among many things, some of the challenges, the occupational health challenges that firefighters have. The project that we're working on with Huffines really came out of both a personal and a scholarly experience. I spent a long time as a firefighter and not always using PPE as we did back in the 80s, but between that and my Navy service and things like that, in 2017, I was laying in the bed in the emergency room here in Bryan, and the doctor came in and he handed me my x-ray and he said, "I think you're going to be a guest here for a while." And that's when I found out I had lung cancer. So in about 6 months, I went from learning that I had lung cancer to having my left lung fully removed because it was just rendered useless from the cancer. So if we can figure out ways that we can make their job safer, that we can prevent injury and illness, if we can do ways that we can increase and improve their quality of life when they do these really dangerous jobs, that's a big public health mission we have. So in 2023, we applied for a seedling grant from the Health Science Center to investigate firefighter occupational medical screening, and really, what did firefighters want? Our focus initially was on the rural volunteer firefighters because those are one of the largest underserved communities in the first responder world. So we did a statewide survey working with the State Firefighters and Fire Marshals Association and the Texas A&M Forest Service, and asked firefighters, hey, would you get medical screening if it were provided? And what would you expect to get out of that? And questions like that. And then in September of 2024, we had a summit where we brought folks into College Station that represented fire departments from all across the state, that also represented the support organizations, the Texas Commission on Fire Protection, and we sat them down and said, okay, so here's kind of what we found out, and how would we design this? Throughout that study, we learned a lot about the barriers that rural firefighters have in getting this occupational medical screening, and it comes down to really a handful of things. One is time, because rural areas are resource poor. They don't have all the medical facilities, and if they did have the medical facilities, they probably don't have the physicians and the practitioners with the expertise to do a proper medical screening for a firefighter. They don't have the time to go other places to get that, and many of these folks are underinsured or not insured or self-employed, and so they don't have the money. So those four factors really were overwhelming in the number of responses we got. And we also asked, so if you were given an opportunity to do this, would you? And what blew us away was more than 75% of the people that responded to the survey said, yes, I would go get this mobile screening tomorrow if I could. So, when we look at firefighters and the dangers they face, which is why this screening is so important, what we found out is that obviously cancer is a big concern. A lot of people would think, oh yeah, lung cancer. Well, guess what? We use respiratory protection, and lung cancer isn't the most prevalent cancer in firefighters. It's not colorectal. It's not multiple myeloma, the most prevalent cancer in firefighters, is actually melanoma. And that's because of the exposures they have and some of the tender skin, their face, and many times firefighters, when they're out working an accident and things like that, they're not wearing their full protective gear, and so they're exposed to the sunlight and the ultraviolet rays that come with that. So those are some of the cancer risks, but that's not the only thing. Yes, 75% of line of duty deaths are attributed to cancer. That's coming from the National Fallen Firefighters Foundation, looking at about the last 5 years. However, more than 48% of the on-scene deaths of firefighters come from cardiovascular disease and sudden cardiac arrest. So imagine you're on the scene of this big fire and you look over and you see one of your firefighters drop dead with a heart attack. That's part of the concern. And so it's not just cancer, it's cardiovascular disease. And the other thing that we really don't have a good inventory on are how many folks die from mental health disorders, PTSD, and the things that go along with that. So there are a lot of things that firefighters can do individually and as a team. As a firefighter, we often work as a team. There are 4 people on that fire engine that roll out. There are 3 people on our rescue crew that they're doing things. We always work in buddies. So, 2 go in, 2 come out, right? Why wouldn't we do our self-maintenance and do our healthy living together? And in this case, our family is our team. So one of the things that when we talk about what can firefighters do, and we know this is important in cancer prevention, we know this is important in cardiovascular disease prevention, is we look at diet and we look at ways that we can eat healthy. And it's not just when we're on shift. It's not just when we're at home. It's a lifestyle. So it's really important that we develop this healthy living lifestyle. I'm not saying give up ice cream. I am definitely not saying give up ice cream. But when it's time to grab that burger or to grab that salad, grab the salad. When it's time to, eat chicken versus eating red meat, take the chicken every once in a while, and learn. The biggest, most important thing that I would tell anybody about their health journey is be your own advocate, which means you need to be smart about it, you need to be informed about it, and you need to know what makes a difference. So don't just put it off on somebody else. Go, boy, I wish I had a nutritionist that came into the firehouse and told us how to eat. Learn for yourself. Learn what evidence-based practices are. And there's been a change in the fire service. When I started back in the 80s, it was just kind of, buck it up and we'll do all this. And we don't need that research. That's just a bunch of people wanting to know how many times a tennis ball bounces. We don't care about that. But the reality is that there's a change where there's a much greater appreciation for science and understanding the role that science plays, which is why things like the Bramhall grant are so important, why things that are so important, like we do at Huffines with our tactical athletes. By the way, I know that people think, firefighters are not athletes, they're just these big old burly guys that do that. But the reality is, no, we are tactical athletes, because firefighters, law enforcement officers, we rely on our athletic prowess as part of our job. So we may not train like athletes, but there's not a reason we shouldn't. And learn how to do that, because we'll rehab better. And when we will get hurt, but when we get hurt, we bounce back better. And it becomes to being about resilience, which brings us full circle when we talk about the USA Center for Rural Public Health Preparedness. Because it's not about just the preparedness, it's about being resilient. And with diminishing city budgets, with diminishing interest in public safety. All of these things mean we have got to be able to bring the folks that are serving back to the line quicker and in a better healthy state. To do that well means that we've got to make sure that we keep them healthy to start with.